Hi, I'm Dr. Danielle Pineda. I'm a board-certified vascular surgeon that works here at AtlantiCare. Myself and Dr. Lombardi and several other vascular surgeons are here to answer any questions you may have about vascular, but specifically today we thought we'd focus on DVTs. The reason for this is that throughout the media, you may have seen that there are a couple NBA players who are benched for the remainder of the season because of the diagnosis of DVT. While DVT is a wide topic to cover in just a few minutes, I'll give a brief overview. DVT stands for deep venous thrombosis. It means that there is a clot that has formed in the veins of your body. The veins are the blood vessels throughout our body that bring blood flow back from our arms, our legs, anywhere in the body back up to our heart. They're also those blood vessels that people poke when they're trying to get an IV. What happens is that sometimes the veins in the center of our arms and our legs actually form a clot. And when that happens, that is what a DVT is. The risk of a DVT is that if it becomes very significant, it can actually break off and go to your lungs, which is a condition called pulmonary embolus. DVTs can form in any vein in your body, but specifically the ones that the NBA players were in their arms and their legs. So what makes these people have DVTs? Why would a young, healthy athlete have a DVT? Well, there's a couple of different risk factors that predispose you to having a DVT. So one is that prolonged travel or immobility. So long flights, such as those NBA players jet setting across the country, can predispose you to it. Other things are being in the car for a long period of time or having an injury that has you sidelined and in bed for a couple of days. Surgery and other things that have you kind of in the hospital for a while can predispose you to having a DVT. Family history is another one. So there are some people who have a history of hypercoagulable states. What that means is that just by the nature of the way you are, you're predisposed to forming a clot. So if you have a family member who has a lot of DVTs and you want to mention this to your primary, they may send you for additional blood work to see if you have a history of these hypercoagulable disorders as well. So what are the signs and symptoms of a DVT? So swelling of the arms and the legs, along with some bluish discoloration, can be one of the biggest symptoms of having a DVT. Specifically in the legs, when you have the swelling and discoloration, you can actually have pain associated with it. So having pain after a long workout or something like that isn't concerning. But if you suddenly develop a swollen leg in conjunction with some pain, that is something that you should bring up to your doctor. If your doctor suspects that you're having a DVT, what are they going to do? So the first thing they're going to do is send some blood work to see if there's any signs that you've recently had a clot event happen in your body. Then they may also follow this up with an ultrasound. The ultrasound is a painless, non-invasive test that looks throughout the veins of your body to see if you have a blood clot. If this test is positive, then you do have the diagnosis of a DVT. Your doctor will likely start you on a blood thinner and refer you to a specialist as needed. So that's our brief summary of a DVT. If you have any questions, please reach out to your primary care doctor. We at AtlantiCare are always here to answer any questions that you have. And so we hope that you will seek expert advice as needed. And in the vascular surgery department specifically, we're always happy to answer any questions. Thank you.